All right, today we're going to talk about the Finger Lakes Community College Nursing Program and what is special about our program, what registered nursing means, and lots of different things to hopefully excite you about your future as a registered nurse. First, I'm going to start by introducing us that are here today to talk about this. My name is Shayna Turner Johnson. I'm an assistant professor of nursing here at Finger Lakes Community College.
And I'm Katie Schaefer. I am the nursing lab coordinator here at the college.
And I'm Tiffany Layden. I'm an instructor of nursing here at Finger Lakes Community College.
First up, Katie's going to talk with us about what is an RN, what does that mean, what does LPN mean, what does CNA mean, hopefully just to clarify any information that you may have heard before.
So CNAs, we'll start there, are certified nursing assistants. That is a 1 month, usually 2 month certification that individuals can obtain, and they go right to the bedside to work with patients and care for them. LPN stand for licensed practical nurses, and that is usually a 12-month certification that results in an exam that gives them licensure abilities to take care of patients. They can work under RNs and or with a provider, so they can be found in multiple different settings. The registered nurse is a 2-year or a 4-year degree, and that allows them to care for patients in multiple settings, as well as provide patient teaching.
So up next, Tiffany's going to talk with us about what you can do if you become an RN in our program.
So once you graduate from our program, the options are pretty much endless at this point for you. So typically, registered nurses, you're going to find working in many different areas like a doctor's office, hospitals, maybe an outpatient surgical center, a cancer center, a hospice or an end-of-life care center, home care, school nurses, and maybe even a research nurse. So knowing that after you graduate from our program, the current legislation states that you will need to get your bachelor's degree in 10 years from when you graduate. But the beautiful thing is once you graduate from our program, you have that 10-year time frame to be able to obtain your bachelor's degree. And we do have admissions agreements with colleges in the area, but you can begin working immediately as a registered nurse once you graduate. So you can get into the workforce a little bit faster and then continue working on your bachelor's degree.
Excellent. So now that we know a little bit more about RNs, LPNs, CNAs, what that means, we know that our program here at Finger Lakes Community College is a degree that ends with an AAS degree, which is an Associate's in Applied Science. As Katie mentioned, there's also baccalaureate programs that students can enter right into. But just to mention, back off of what Tiffany said, if you go for an associate's degree first, you can get out to the workforce just the same as if you went into a baccalaureate program first. So coming to Finger Lakes Community College allows you to finish your degree in as quick as 2 years and go right out to work as a registered professional nurse, while then working to obtain your bachelor's degree within that 10-year time frame that the current legislation says you have to do. So why our program at Finger Lakes Community College? We all certainly here today with you love our nursing program at Finger Lakes Community College. Katie's even an alum of our program here at Finger Lakes Community College and is very proud of that aspect. Our program offers small class sizes, as small as 8 students in the clinical setting, so 8 students to 1 instructor in the clinical setting, small group settings in our lab. We are also within the next 5 years going to have a nice brand new updated lab and simulation building here for our nursing students to work in and learn how to take care of patients. We have simulation mannequins that can talk and cough and have pulses, and you can see their chest rise and fall. So really, really exciting way to learn how to take care of patients before we're actually in the clinical setting. Our college also has a really wonderful community feel. Students get to know their instructors, instructors get to know the students, and it's a very nurturing type of relationship here within the nursing program. Once you have decided to come to our program, if that's what interests you and you're thinking about going into healthcare and you finish your AAS here with us and you go on for your bachelor's degree in 10 years, there's also many other things that you can do after you finish those degrees. You could go on to be a nurse practitioner. You could be a pediatric nurse practitioner. You could specialize in gerontology, which is care of the older adult patients. You could go on to be a certified nurse midwife and help to deliver babies. You could go on to be a certified registered nurse anesthetist and work in the operating room alongside anesthesiologists. There's endless possibilities that you can do once you start and get your registered nursing degree. There's so many different things that you can go on to do.